Pickleball. It's one of the fastest growing sports in the country, almost now leading to some major injuries, too. A new study finds that pickleball has led to a spike in broken bones among those 60 years and older. They say the fractures mostly happen from falls on the court. That makes sense. And women are more likely than men to break a bone while playing. Joining us to talk about that and some other health topics that are in the headlines this week is Dr. Jeff Pothof, UW's Health Chief Quality Officer. I played high school football and baseball. I played some rugby in college. My worst injury was on a pickleball court. So I wasn't all that surprised to hear that. What gives here? I mean, is it just people jumping into a sport that they think does not look that strenuous?
Yeah, I think it's a few things. I think when you think of pickleball, you're like, well, it's not nearly as aggressive as tennis or some other sports. I think it attracts individuals then that maybe don't have the same fitness level. It's great that they're getting out there and they're playing pickleball, but especially for those over 60, lots of times there's some comorbid conditions, namely osteoporosis, and most of these injuries are happening because of falls. The interesting thing is that in men, their falls tend to be a little bit more severe. They're breaking hips and legs. In women, they're hospitalized at a lower rate. More likely breaking those upper extremities. But I just think a word of warning to folks playing pickleball, especially if you're older, make sure you're tightening those laces and that you're not at risk for falls because you actually can get injured playing pickleball.
You answered a question before I asked her. Did men 2.3 times more likely to need hospitalizations? And you just mentioned they have different types of falls, it seems. Like you say, they're...
Yeah, different injuries with their falls. So in the study, what they found is that when men are falling, and they don't know why, they're breaking things like hips, lower legs. With that injury, you're unable to walk at all. So you get admitted to a hospital at a much higher rate than, say, someone who breaks an arm or injures a bone in their hand.
Gotcha. I would suggest getting good shoes, not using running shoes, too. That'll help on the falls. All right, let's talk about a new study that suggests if we do more for the mental health of teens and adolescents, we could really lessen the number of kids needing treatment for mental health, because 44% say they're using drugs and alcohol to cope with a problem they're worried about. 40% say they're using it to fight anxiety and depression. Those numbers don't seem surprising, but they can be lowered.
Yeah, I think, this is a concerning kind of study because we're looking at teenagers. And what it says basically is that, 45% of teens say that they're using drugs and alcohol basically to self-treat for depression and anxiety, which suggests that they're not comfortable or the resources are not there to get diagnosed and then put on medications that not only are more effective in treating depression and anxiety, but are much, much safer. The drug supply out there today is heavily contaminated with fentanyl. These can be lethal overdoses that happen. So I think the heart of the matter is we need to make it safe for kids to say, hey, I'm struggling with anxiety, I'm struggling with depression. We've got to get them in to see medical professionals, get them treated, and not stereotype them as something wrong with that individual. Mental health is a disease just like stroke, just like heart attack. We should treat it the same way.
Amen to that, for sure. Let's talk about some good news with depression and anxiety. Drugs that are used for weight loss, Ozempic and Wegovy, they're helping with anxiety. Is this just a nice coincidental offshoot, or is there a reason for it?
We need to figure out the reason, but there's this association that seems to exist between people who use these GLP-1 agonists like Ozempic, initially on the market to treat diabetes, found to be very effective in reducing weight. And now this study that says that you can reduce depression and anxiety by 40 to 60% if you're on them. We don't know if that's something intrinsic about the medicine that reduces depression and anxiety, or is it that they're losing weight, they're more active, they're able to exercise, that's reducing depression and anxiety. So more work to come on whether it's a primary reducer, does the medicine do it itself, versus is there secondary things there that make people who are on these medications less likely to report depression and anxiety.
Either way, encouraging news there. All right, Dr. Jeff Pothof, UW Health Chief Quality Officer. Always great talking to you on a Tuesday.
Thank you.